Hello, everyone, and welcome to today's anatomy lecture. I am Dr. Amma Muhammad, and today we will explore the fascinating structural architecture of the human thorax and the essential subdivisions of the mediastinum. Our lecture today is divided into three logical chapters. First, we will examine the skeletal structure of the thoracic wall. Then we will look into the intercostal muscles and neurovasculature. Finally, we will break down the subdivisions of the mediastinum. Let's begin with Chapter 1, where we will study the bones that form the cage-like protective framework of the thorax. The thoracic cage is composed of three main skeletal elements: the ribs, the sternum, and the thoracic vertebrae. Together, they form a flexible yet highly robust protective shield. We classify the 12 pairs of ribs into three distinct groups. Notice that ribs 11 and 12, the floating ribs, lack anterior attachment, making them especially vulnerable to trauma. This diagram illustrates a typical rib. Please pay close attention to the costal groove along the inner lower border. It is a critical landmark as it houses the intercostal nerves and vessels. Not all ribs are typical. Ribs 1, 2, 10, 11, and 12 possess special characteristics. For example, rib 1 is uniquely short and flattened to accommodate the subclavian vessels. The sternum is composed of three parts. The junction of the manubrium and the body forms the sternal angle, which aligns with the T4 vertebra and is the essential surface landmark for counting ribs. Now, looking from a superior perspective, we see a typical thoracic vertebra. Its heart-shaped body and specialized costal facets are perfectly adapted to articulate with the ribs. Let us move on to Chapter 2. Here, we will dissect the muscular layers of the intercostal spaces and study the pathways of their nerves and vessels. There are three distinct layers of intercostal muscles. The neurovascular bundle is situated between the internal and innermost layers, structured from top to bottom as vein, artery, and nerve. Finally, we reach Chapter 3. We will explore the central compartment of the thorax, known as the mediastinum, and examine its anatomical boundaries and organs. The mediastinum is split into superior and inferior sections by a horizontal plane at T4. The inferior mediastinum is further divided into anterior, middle, and posterior compartments. To help you memorize this, let's look at this cross-section. The heart is in the middle, the thymus is in the anterior, and the esophagus and aorta run in the posterior compartment. That concludes our lecture for today. I hope this structure helps you visualize the complex relations of the thorax. I'll open the floor to any questions you may have. Thank you.